Hello, everybody. I think we're going to go ahead and get started.
Yes, if you don't have a copy of the presentation, Susan's presentation, it's on our website, CLLMD. By the way, I'm John Feldman from CLL. It's on our website. You can download it. For those on Zoom, they can actually go to the website. They can open up the presentation and download it if they want. So even though the screen's not looking so hot, you can follow the presentation by looking at your copy of it. And then we hope to have this video up on our website under video presentations in the next few days. So for those that may have missed it, if you have some friends that wanted to see it, just refer to our website and it should be there shortly.
And we will have a link in the Leisure World News for the website as well.
Yeah, like that, and we're going to get this up on the Leisure World 974 channel too. It takes a while because we've got to put a little announcement in the newspaper, and so it needs some advance time. So 4 to 6 weeks, whatever it takes to get this announcement published, and getting the video down to ENR is not an issue. It's just to get the word out. Good. Thank you, Susan, for that.
Okay. Well, welcome everybody. Thank you so much for coming to see the ABCs of the Leisure World Social Work Department. My name is Susan Montgomery, and I'm the director of the Social Work Department here at Leisure World. And I emphasize the name Social Work Department because we recently had a name change. We used to be called the Department of Social Services, but then people got us confused with County Social Services, so we decided just to go with something very simple, social work. Slide change. So even with the name change, our mission statement has remained the same, and that is to assist the residents of Leisure World to stay safe and independent while achieving life satisfaction in the community. And I think this slide really says it all. It looks like they're having great fun here. In today's presentation, we're going to give you a broad overview of the department and talk about how we're here to support the mission statement. So we've divided up the topics. Each of the social workers are going to be focusing on different areas of what we do. And I'm going to start, and I'm going to be talking to you, kind of giving you a general overview of the department, what kinds of services we provide, who refers to social work, how you connect with us, and of course, most importantly, who your social workers are. There will be time at the end of the presentation for questions, so I'm going to ask if everybody could hold those questions until the end. Next slide. So I'm going to start with the introductions. We have 5 social workers here in Leisure World, 2 full-time and 3 part-time. But combined, we have over 150 years of social work experience. We are all master's level prepared social workers, and we are all LCSWCs. And what that stands for is Licensed Certified Social Work with a Clinical Emphasis. And that's actually the highest level of licensure that you can get in the state of Maryland. So as I said, I'm Susan Montgomery, Social Work Director. I've been here for 7.5 years. I am one of the full-time people here. And prior to coming to Leisure World, I spent 30 years in the field in the health and neuro health, both at the nursing home, inpatient hospital, acute rehab hospital, and private practice fields. Next to me, or not next to me, but the way I wrote it, she was next to me, Wilma Braun. Many of you may know Wilma. Wilma's been here for 23 years. Wilma works 2 days a week, Tuesdays and Thursdays. And prior to coming to Leisure World, Wilma worked as the Director of Social Work at the Washington Adventist Hospital. And Wilma is our Medicare and insurance specialist. Next we have Sandy Hart. Sandy works 20 hours a week. Sandy has also been here for 7 years. And prior to working at Leisure World, Sandy worked for 20 years as the Director of Social Work at one of the local skilled nursing facilities. And Next here, we have Ann Johnson. Ann is the other full-time social worker, so Ann and I are the two full-time social workers. Ann has been here for 5 years, and previous to that, she worked for 20 years in the field of home care, hospice, and community social work. And last but not least, we have Miko Masterson. Miko's been here for about 2.5 years, and she spent 20 years in the social work field, most recently in the private practice industry. So as you can see, we have a very seasoned group of social workers here for you. Next slide. So next, I'm going to talk about how you connect to us. So first, I just want to say our services are free to all of the residents in Leisure World. We are located in the MedStar Medical Center, which is, of course, right across the street and down 1 block from Clubhouse 2. And I think being in the medical center, it's great because everybody has easy access to us through the transportation system in Leisure World. The shuttle goes there, the Dial-A-Ride and the accessible van transportation goes there. But it also allows us to work as part of the healthcare team with the MedStar physicians for those patients that are MedStar. But again, I just want to stress to everybody, even though we're located at the MedStar Medical Center, we work with all of the residents in Leisure World. Our offices are staffed Monday through Friday from 8:30 to 5, and we have office visits by appointments or by walk-in, although we do prefer appointments because then we know you can be seen right away. We do a lot of our work on the phone, a lot of phone consults, and for those residents that are homebound or have difficulty getting out, we can do home visits as well. So the main social work number up there, it rings directly into my office, and my email is up there as well. But we all brought our business cards today, and they're on the back table, so you can feel free to grab any of the business cards you want. Next slide. So, who refers to social work? Well, we get our referrals from a variety of places. We get self-referrals, we have family members who refer, we have friends and neighbors, outside agencies, we get referrals from MedStar staff, we get referrals from the Leisure World staff, particularly security, property managers, even PPD. And just to give you an example, last year in 2021, in looking at the new referrals that we got, 42% were self-referrals, and we always like to see that as a high number because that tells us that you know about us, and we're always trying to get the word out there. We had 13% of those referrals were families. Leisure World staff made up about 19% of the new referrals. MedStar staff, about 16%. Outside agencies, 6%. And friends and neighbors, 6%. And the other thing I just want to mention here is that all of the calls that come into us are kept confidential. Next slide. So last year, we worked with approximately 29% of the residents in Leisure World. And I'm going to talk a little bit about some of the things that we do. One of the things that we do are assessments. So we can do psychosocial assessments to address any of the health, emotional health, cognitive health, social health, and any other ongoing needs that somebody has. We do a lot of work on crisis intervention. We are often called in to manage crisis situations, whether that be somebody wandering in the community or somebody who might be confused, or a hoarding situation, or somebody who's having a health or mental health crisis. And just to give you an example, when we had the fire in 19B a year and a half ago, I was called on a Saturday, the morning after the fire happened, and we worked 7 days a week over the next month and a half to identify, to connect with each of the residents, identify needs, and help them by providing resources for those immediate needs. We maintained a relationship to assess for ongoing needs. We were the main contact for the Red Cross and for the Montgomery County Department of Aging. And we were also tasked with managing and distributing funds from all the donations that we received. Another thing that we do a lot of is information and referral. The social workers work with the residents and their families to identify needs and make recommendations and referrals with the goal of helping them to stay safe and independent. So how do we do that? Well, we get a lot of feedback on referrals that we've made from families, from residents, what they liked about the agency, what they didn't like about the agency. So we really depend on that feedback. We also do in-depth, face-to-face interviewing of agencies. And we also do on-site visits. So we'll go and visit some of the assisted living programs or some of the group homes or some of the skilled nursing facilities, just so that we can put our eyes on them and have an idea of where we're referring people to. We then take all of that information and we use that to help us guide the residents to resources that might best fit their needs. This is definitely not a one-size-fits-all. The social workers can assist residents with making phone calls to some of these agencies. We can help you to fill out applications. We also have developed a community resource guide and a transportation resource guide. I'm going to talk a little bit more about those in a minute, but they have a ton of resources in them. So some of the resources that we refer to a lot that are not listed in the community resource guide are the home care agencies. And the reason we don't put them in there is because we think it's extremely important to work with the residents and get a good understanding of what their needs are. And then we can refer them to an agency or agencies that we feel might best fit their needs. You know, we really have to be very familiar with all the resources that are out there. And this is kind of the good news, bad news for the social workers. Good news is we're in Montgomery County. There are a ton of resources out there. Bad news for the social workers is we have to know what they are, and there are a lot of them. We also do a lot of long-term planning. Social workers are available to assist residents with planning for their future needs, whether those plans mean aging in place or looking to see what next step options might be. And I think it's really important to let everybody know that, you know, everybody has the right to live in their own home. I think sometimes people are afraid to reach out to us because they think, oh, those social workers, they're going to kick us out of our home. That's not our job. That's not something we can even do. So I just want to, you know, be clear because I've heard that many, many times. We also do a lot of work with advanced directives and MOLST forms. I know Wilma's going to talk more about that. We do a lot of Medicare, Medicaid, and insurance counseling, Part D, all the parts of Medicare, and Wilma's going to go over that as well. We assist the community administration, mutuals, and security to help problem solve. Multiple occasions when we get called into situations where they need the assistance of social work, and when these issues are identified, the social workers help we work with the families, we work with the residents, sometimes the MedStar staff, Leisure World staff to help resolve these concerns. Sometimes these efforts are extended over many months or over many years as we work to effect change. We also work closely with security in that we follow up on all security reports. In terms of other services, we do speaking engagements, just like we're doing today. We talk really to many groups in the Leisure World community on a variety of topics, and we've spoken to the Kiwanis Club and the Low Vision Group and the Lions Club and the Stroke Club and the Kiwanis Club, and we often get called in by the mutuals to do presentations to their communities. We also participate with several advisory committees, including the Health Advisory Committee and the Mental Health Subcommittee, and we have been called in on occasion to work with the Emergency Preparedness Advisory Committee and the Security and Transportation Committee. Just one word, I want to talk about the pandemic and the vaccines. When the vaccines first came out, the social workers were called in to help people get registered. And if you remember, in order to get the vaccine, you had to be registered with Montgomery County, and we have a lot of residents. We have a lot of residents in Leisure World. We have a lot of residents in Leisure World who, while they might own computers, they might not feel very comfortable registering themselves. So we were getting 40 calls a day to help people get registered. So we helped folks to get registered. We helped to find transportation for them to get to their vaccinations. We worked daily and daily meaning, through the weekends, working with MedStar to make sure we could fill up their leftover vaccines. So, you get a vial, you open up a vial, and you have maybe 10 people come in, or 9 people come in. You might have a vaccine that's left, and they don't want to throw it away, but once it's been opened, they have to use it. So then we would start calling residents to see if they could come in. We also worked really closely with the Maryland Department of Health. We brought 2 walk-in vaccine clinics here. They were in Clubhouse 1, and I know they served quite a few residents. We've done 2 of those. We're hoping to do another one soon. And we also worked really hard to develop a homebound vaccine list that we worked with the Maryland Department of Health. And I'm proud to say that we had over 45 homebound residents who were able to get vaccinated. Next slide. So this is the community resource guide I was telling you about. We update this every year. We do have copies on the back table for you to take with you. And we have everything in here, everything really from A to Z. We have adult day programs and social programs and meal and food delivery programs and durable medical equipment and supplies and veteran services and low vision services. Got Montgomery County resources are in there. There's just so many resources that are in there. We have the Parkinson's Foundation contact information and the Alzheimer's Association. So please feel free to take one of those with you today. The other guide that we put together is the Transportation Resource Guide. So in the Transportation Resource Guide, that's also available for you in the back, we have resources both inside and outside of Leisure World. So we have inside, we have information on the Dial-A-Ride program and the accessible van transportation. We have the shuttle buses and the shuttle bus schedules in there. And then we also have outside resources like Metro Access, Senior Connections, GoGo Grandparent. GoGo Grandparent it's kind of like an Uber for seniors. And we have Call-In Ride. We've just got a lot of good information in there. What we don't include in there is we do have a list of people who drive, but they're not vetted, so we do not put that in there. But there are resources that you can use to get drivers in the resource guide. So now that I've given you some information about who we are and what we do, I'm going to turn this over to Ann Johnson, and she's going to be talking to you a little bit about home care, palliative care, and hospice care.
Good afternoon. So as Susan said, I'll be talking today about care options in the community, such as home care, non-skilled care, which is also known as custodial care, palliative care, and hospice. Next slide. In skilled home care, if you have Medicare Part A, you must meet the 4 criteria. That a doctor decides you need medical care at home and has and has seen you within the last 90 days. You must need at least one of the following intermittent skilled nursing care: physical therapy, occupational therapy, or speech therapy. Skilled nursing is defined as services and care that can only be performed safely and correctly by a licensed nurse. You must be homebound, and what that means is that you have to take considerable taxing effort to get out of the house. That Medicare does say that you can go to church, to medical appointments, and to the grocery store, but you can't be out driving around, going to the mall, and different things like that. You also must use a Medicare certified agency. Prior hospitalization is not required to receive home health services under Medicare. And the home care process goes, it's a collaboration with the attending doctor for symptom management that you may be experiencing. The home care staff coordinates your care and or therapy and is the link between you and your doctor. The nurse that comes is there to teach and educate on medications, on wound care, catheter care, IV therapy, and they do assessments constantly from the head to the toe every time that they come to see someone. Home care is short-term and it's intermittent with the goal to provide treatment for an illness or an injury. It helps you get better in your own home, regain your independence, and become as self-sufficient as possible. Each benefit usually lasts for 60 days, but it also can be extended if it's needed. Next slide. Non-skilled home care. This is also considered called custodial care in the industry. This is services of a home health aide, a certified nursing assistant, a certified geriatric assistant, or a med tech. When only custodial daily care is needed for activities of daily living, which is bathing, dressing, grooming, transferring, cooking, things like that. Okay, sorry. Better? Thank you. A med tech is a certified nursing assistant who can manage somebody's medications. Under custodial care also comes companion care services, which is not, they do not do any personal care. They do taking to doctor's appointments, socialization, taking you to the mall, to the beauty store. The social workers here, we only refer to licensed bonded agencies. These agencies do background checks, they do fingerprinting. During COVID, they did COVID screening, provided supplies to their aides. They do license checks for the aides and drug testing. Agencies, they have a live-in or an hourly care option. They can be for as little as an hour or as much of any combination up to 24 hours a day. And these services are private pay. Some long-term care insurance covers some of these programs depending on your policy. And if you need help with 2 out of the 5 activities of daily living, or if you need supervision due to a memory impairment. Family and Nursing Care is an example of one such agency that we have here on campus. They will do a minimum of 1 hour for our residents here, and then any other combination up to 24 hours a day. And our community resource guide has a list in the back, has a list of questions that you can use when you're interviewing an agency, questions for when you want about the aid that's going to be sent to you, and also about the cost of care. Next slide. Palliative care is another step in the healthcare continuum. And the goal with this is to improve the quality of life for both the patient and the family. This is a doctor-ordered program and you must meet the same criteria as in skilled home care. The medical model deals with chronic illnesses and curative treatments while managing pain and providing comfort measures and reducing stress of the patient and the family. The nurse usually looks at the medication and deals with the disease management, the patient care teaching, and chronic care of self-management. They assist the family and patient to adjust to the change that the illnesses are bringing about and presents options for care. Within palliative care, there's also the therapies of the physical therapy, occupational therapy, and the speech therapist. And you can use palliative care while you're seeking treatments, active treatments. And it helps the family make medical decisions and choices related to their life-altering illness. The common diseases that palliative care address are things such as heart failure, cancer, lung diseases, chronic liver or renal disease, the dementias, strokes, chronic pain, and other serious life-threatening illnesses. Examples in Montgomery County of palliative care are Capital Caring, Montgomery Palliative Medicine Consultants, and Holy Cross. Next slide. The next program in the continuum is hospice. This is a program, like Susan said, that I worked in for over 20 years, so I have a little bit of some compassion, and it's very close to my heart. So hospice is an individual holistic approach to a special kind of care. It's a journey, it's a process. It's not stripping you of your doctors, your medications, or your dignity. But hospice really is the following. It's patient and family-centered. It's ordered by your doctor. Care is provided wherever you call home. Could be your condo, could be assisted living, could be a nursing home, your daughter or son's house. It's having an advocate. It's honoring the patient's wishes, desires, and goals of care. It coordinates the care of a person by a multidisciplinary team. It is a team working together, weaving a close-knit net to hold the patient and the family up in a very stressful, intimate, uncertain, and scary time of life. It's thinking outside the box, being creative, personal, and compassionate. It supports the patient on many levels, the psychological, the physical, spiritual, and emotional well-being of a patient. There's a lot of caregiver education that goes on, and it also embraces each patient and family as a unique encounter of life and to walk the journey with them. And to work in hospice and with families, it's an extreme honor to be able to do so. The focus of hospice is on comfort and alleviating other distressing symptoms while not on curing an illness. With hospice, you don't have to give up anything. You don't have to get in bed and stay. I say that because I had a patient say that to me once upon a time. But you do have to live each day to the fullest. And all these things described is really what hospice is all about. So you might also ask, what does hospice look like? Hospice comes under your Part A of Medicare. It covers 100% of the service. Almost all other insurance companies have a benefit carved out in it also. The doctor determines the eligibility based on the Medicare guidelines of 6 months if the illness follows the normal trajectory that it might. You have lifetime coverage of hospice, which is broken up into benefit periods, and you're continually assessed by the nurse if you're appropriate. People do graduate from hospice if their condition improves, and then you can also return at any point in time. Next slide. One thing, there's a myth that hospice is only for cancer patients, but it's not. It's for people with heart, liver, pulmonary diseases, and neurological diseases, for AIDS or HIV, for renal failure, for stroke, any kind of dementia. Hospice doesn't look at the curative measures, but it's looking at maintaining the quality of life. Next slide. So the team of hospice is the medical director of the particular hospice, the patient's primary care physician, a nurse, social worker, home health aide, chaplain, volunteers, and bereavement team. And you might wonder what hospice pays for. You can always get a one-time evaluation to see if you're appropriate or if you really want hospice. It pays for respite out of the home, medications related to your illness, soft supplies, durable medical equipment, and bereavement for 13 months after someone passes away. It also pays for short-term inpatient stay for any pain and or any symptom management that can't be controlled at home. Excuse me. You also have access to a nurse 24 hours a day, 7 days a week, 365 days of the year, and that also includes snowstorms, rain, hail, and sleet. So what's not covered? The cost of a nursing home or assisted living, the housing part of it, if you live other places other than home, 24-hour nursing care, and anything that's not approved by the hospice team. Examples in Montgomery County of hospice is Holy Cross Hospice, Montgomery Hospice, Capital Caring Health, JESSA, and there's a unique program called Caring Matters, which is a non-medical volunteer-based program that can be used in conjunction with a hospice or on its own. Next slide. So something to remember about hospice is that you can stop it at any time. You can graduate at any time. The main thing is to start early to reap the benefits of this great program. In this slide, called this video, Hospice, Something More, it's a documentary that was done. It's an hour video done by real life patients, and they tell their story about the hospice journey. You can find it on YouTube, or you can find it at the Hospice Foundation of America's website. It really depicts and shows real life how you can experience hospice. In conclusion, the care in the community is a very fluid process. One can move easily from one program in the continuum and back to another and back again. Insurance covers all these programs except for the non-skilled home care, but the long-term care may be able to cover this. And an important point to remember is to start the process early, and also to please come see one of us social workers so we can help create a plan for you. Next, my colleague Miko Masterson will be talking about mental health, cognitive changes, and caregiving. Thank you.
Hello, my name is Miko Masterson. I'm one of the social workers. As Susan Montgomery, our director, has said as well, that I am a part-time social worker. I work 30 hours a week, Tuesdays through Fridays. And I am the newest member of the social work team. I've been here for 2.5 years. I feel very honored to be a part of this exceptional team. And I have a background in mental health and a passion for working with people with serious illness. So today I'm going to be talking about mental health, cognitive change, and caregiving. Next slide. So the first thing I wanted to say is that mental health problems are not a sign of normal aging. And as we have been dealing with this pandemic, we are hearing so much about pandemic stress and all of the stress that comes with being so isolated and afraid for our lives all of the time. But there are other mental health conditions that people can experience as they age, and that can include stress and anxiety over a number of different issues. That can include depression, and that can include grief and loss as we lose members, family members and people that we love. Next slide. And there are a number of reasons why someone can experience a new mental health challenge as they age. For instance, it can come from changes in physical or cognitive health. It can come from the loss of independence or chronic health issues, the loss of mobility, or the loss of a loved one. Next slide. The important thing to know is that if you or someone you love is experiencing a mental health challenge, you don't need to suffer alone. We're here to help you with these challenges. And there are a number of services that we provide. My director, Susan Montgomery, did talk about the assessment services that we provide. And basically what that is we sit down with each and every client that comes to us, and we do a comprehensive assessment. We sit down, we get to know you, we get to know what your needs are, and we brainstorm with you how to find some solutions for how we can meet those needs. Another thing that we can do is we can help you to communicate with your doctors and medical professionals and advocate for you with your doctors when that is needed. And a large part of what we do in the social work department is providing community referrals. And we are very knowledgeable about resources in the community and how to connect you with those. And we can provide referrals, keeping in mind, keeping on the topic of mental health, we can provide referrals for therapists. One of the agencies that we often refer to is called JESA, Jewish Social Service Agency. They're unique because they have an office right there in the medical center building. So they're available to meet with residents in person. It's important, at this point I need to mention that we in the social work department do not do therapy. Although many people come to us, they want that service, they think that we can stand in that way. We do not provide those services, but we refer to outside therapists. We also make referrals for psychiatrists and also support groups in the community. One such support group would be the NAMI support group, which stands for National Alliance for the Mentally Ill. And then we also make referrals for other resources such as EveryMind, which provides mental health education and support, and also the Crisis Center when that is appropriate. And we also believe that socialization is very important for your mental health. So we refer to programs such as the Pen Pal program, which is a program that we here in the social work department have kind of developed for the Leisure World residents, as well as the Friendly Visitor program, which is a program of the EveryMind. Next slide, please. So next I'm going to talk about cognitive change and caregiving. And many people we know experience cognitive changes as they age. When I use the word cognitive, this is a field term, but I want to define it that it is speaking of anything related to how a person thinks, reasons, or remembers. And cognitive changes, as I said, with mental health problems, cognitive changes are also not a sign of normal aging. A lot of times cognitive changes and mental health conditions can look similar, but they are different. And it's important, keeping in mind that it's not a sign of normal aging, it's important for you to address these changes that come up early on, to get help early, to slow the progression of illness and have a better outcome. Next slide, please. And so what can the social workers do to help? We can help by helping you communicate with your primary care provider. We can make recommendations for neurologists in the community. One of the services that we provide is we do cognitive assessments, and the primary one that we use is called the Montreal Cognitive Assessment. And what that does is it provides a baseline understanding of your functioning at that point in time, and then we can do it again over time to track how things change over time. And we can make referrals to help you stay safe in your home and help you live the best life that you can, even with the cognitive change. Some examples of referrals that we make would be Memory Cafe, which is a social hour for people with early memory loss, and they usually bring a loved one with them. Also, we can refer to a group called the Kensington Club, which is also a recreation program. And it's also for people with memory loss, earlier stages of memory loss. And then we do make referrals to adult day programs. And what an adult day program is a program where you would come in, they would provide exercise and games, talk about current events, trivia, all kinds of fun activities. I worked for one myself and it was very fun. And they usually provide a lunch and 1 or 2 snacks a day. And it's just designed to keep the person with memory loss happy and engaged. And some of the adult day programs in the area would be Winter Growth, which is an excellent option for the Leisure World residents because they do provide transportation, and also Holy Cross Adult Day Program. Next slide, please. And finally, we're going to talk about caregiving. And many of us will become caregivers at some point in our lives. And if you have ever been a caregiver to a loved one, you know that it is a very intensive and life-changing experience. And you also would know that it is a very busy time of life. It's a very, there's a lot going on. And so a lot of times caregivers can kind of push their own needs to the side in favor of dealing or giving their loved one what they need. However, I want to say that it's very important, vitally important, for the caregivers to take good care of themselves. If you don't, you can experience something called burnout, caregiver burnout, and signs of caregiver burnout could be fatigue, a sense of overwhelm, sense of anxiety and depression, or irritability, sleep difficulties, disturbances in social relationships, or just not wanting to be with your friends, can have family conflict and marital conflict, employment problems, and in its most extreme cases, you can have your own physical health problems. Next slide, please. So we're here to support you in your caregiving journey. We want you to get help early. We want to assist you as you get help early. We want to help you to communicate with your doctors and your specialists and to connect with resources. And some of the resources that we help you connect with is, as my coworker Ann discussed, we do help you with referrals to home care, and we do refer to home care agencies that are licensed, bonded, and insured. And we also provide referrals for the ARC Respite Program, which is an in-home respite care program for live-in caregivers. It provides 140 hours of free home care services, and almost everything free is good, so I like to refer to this program. And it also pays for, or can pay for, adult daycare programs and short respite stays and assisted living facilities, and my coworker Sandy will be talking about that. It's important to note that the respite program is not income-based, but it is on a first come and first served basis. So their their fiscal year starts July. So if you are interested in the respite program, please come see us at the end of the program and or take a card and we can help you get connected with that. We also refer to adult day programs, which I talked about. I mentioned that again because it is also very beneficial for the caregiver and gives them a break from their caregiving responsibilities. And we also refer to to support groups inside Leisure World and outside Leisure World, such as the Leisure World Alzheimer's Caregiver Support Group and the Holy Cross Caregiver Support Group. So I also like to refer to the Alzheimer's Association and different programs and books that provide education on the caregiving responsibilities and also brain health. I think being empowered with that knowledge can help you to prevent or slow the cognitive changes. And there's also a resource called the Alzheimer's Store, which I like to refer to as well. It has a lot of gadgets and products that are designed to keep the person with the cognitive health, or excuse me, the caregiver. It's designed to help them to keep their loved one safe and active at home. So it could be games, it could be safety products. And next slide, please. So we're here for you, as I said, in your caregiving journey and beyond into the grieving process. And we've developed a number of resources to help you. The first one would be a survivor's checklist, which will help you get organized and sort out the tasks that need to be completed within the days and weeks and months after a loved one has died. We also would refer to support groups such as the Caring Matters Bereavement Support Group, which is something that is held here right in Leisure World, and also grief counseling through local counseling centers and hospices. So next slide, please. So in short, the message is call us. We're here to help you and happy to help you. So now I'd like to introduce my coworker Sandy Hart, and she will be talking about next steps and other resources.
Hi everybody, let me make sure this is right. I'm Sandy Hart, and I'm here to talk to you about options if you decide that you need to move to a more supportive environment from Leisure World. The social workers are available to sit down and look at which programs might best meet your needs for both long-term and short-term assistance. I'm going to go over several different types of programs, including Independent Living Plus or Supportive Independent Living, assisted living in both facilities and group homes, continuing care retirement communities, and skilled nursing facilities. Next slide. So currently, you all live in an over 55 active living community. There are facilities that have supportive independent living or independent living plus. These offer more help like meals and housekeeping, and in many of these facilities you can add on additional services such as personal care and medication management. This is still considered independent living. You have your own apartment, but you have more options for assistance. Next slide. Now in assisted living, there are facilities and group homes. Next slide. Facilities. In an assisted living facility, you are able to have your own apartment or room, and you will have assistance with medication management, personal care, meals, housekeeping, laundry, and activities. It is important to note that these apartments do not have stoves, but may have microwaves and small refrigerators. Assisted living facilities can have memory care units, where individuals with memory-related disorders can have all of their needs met while living in a safe and secured environment. In assisted living, you will have access to 24-hour care. Medicare does not pay for assisted living, but most long-term care insurances do. How does assisted living compare to independent living plus? Well, assisted living provides 24-hour monitoring, whereas independent living does not. Next slide. Group homes. Group homes are licensed homes in the community that generally have anywhere from 4 to 10 residents in a more intimate home environment. They provide the same services as the assisted living facilities, including medication management, help with personal care, meals, laundry, and activities. Medicare does not pay for group homes, but again, long-term care insurance does. Group homes tend to be slightly less expensive than assisted living facilities. Next slide. Memory care. Memory care is available in assisted living facilities, available in group homes. These may or may not have be secured, and 24-hour care is provided. Next slide. Payment for assisted living. Well, it's not covered by insurance or Medicare or private insurance. It's not covered by Medicaid, but it can be covered by long-term care insurance. There are group home subsidies, but there's long lists, and you must qualify, and there are long waiting lists. Assisted living facilities cost between $7,000 and $12,000. Group homes can run between $3,000 to $10,000. So that kind of gives you the differences in pricing. Next slide. Continuing care communities. They provide all 3 levels of care: independent living, assisted living, and skilled nursing facility. Next slide. Skilled nursing facilities. They provide both short-term care and long-term care. Before COVID, someone had to be in the hospital for 3 days or more inpatient before being able to go to a rehab facility covered under Medicare. After COVID hit, this rule was changed and the 3-day stay was no longer required. We do not know how long Medicare will continue to do this, but I think today they're still doing it. When you go to a rehab following hospitalization, this is called subacute rehab. Medicare pays 100% for the first 20 days as long as you remain skilled and they can document progress. Medicare can continue to pay a portion, and your secondary can also pay past day 20 as long as you meet the guidelines for needing skilled care, and they can continue to show progress. Long-term care. When someone needs more care than assisted living can provide, they will need to go to a skilled nursing facility. Medicare does not pay for long-term nursing home care. Once an individual qualifies, meaning they use their resources to pay for the nursing home, they can qualify for Medicaid, and long-term Medicaid can pay to keep them in a nursing home. Next slide. Respite. Respite means an interval of rest or relief. Now, Miko just provided you some information on the ARC respite. Short-term assisted living is referred to as a respite stay. Facilities such as assisted living can be a very helpful short-term resource for the caregiver if the one they are caring for requires 24-hour supervision or needs more support in their absence. For instance, to allow the caregiver ability to be hospitalized or rehab themselves. Respite can also be used if you are coming out of the hospital and you are not ready to go home yet. You can go to a respite program to continue your recovery. Respite is offered in many assisted living facilities or group homes, but not all. It's good to ask. The main difference between these types of programs is size. Both assisted living facilities and group homes can have respite care, but not all do. We have copies of the most recent Positive Age Source book that has a lot of information about these in supportive environments. And this is it. It's right off the press, is brand new, and they're back there too. Next slide. Veterans benefits. There are several veterans benefits that may be helpful to our veterans and their families. There's disability compensation, aid and attendance, and the veteran pension program. All of these, though, can be extremely time-consuming and take months to get. If you're in the hospital and you're thinking, okay, I'm going to need to pay for help at home now, that is not the time to try to get aid and attendance. It takes a long time, so want people to be informed of that. There is also a new VA facility in Gaithersburg, and we can help you get some more information on that. And on page 86 of this book, it has some veterans information as well. And now, Wilma is up next, and will be providing information on insurance and advanced directives. Thank you.
Good afternoon, everybody. Can you see me? My main challenge. Susan, Ann, Miko, and Sandy have outlined how social work can assist you in living an independent, safe, and satisfying life here at Leisure World, and also options that might be available to you if you need more support than social work offers. I'm going to talk to you about two other areas, thank you, of importance where social work can be of help: health insurance issues and advance directives. Now, most of the residents here in Leisure World are insured through Medicare. You've earned your Medicare coverage by working under Social Security for 40 quarters or 10 years, and paid Social Security into Social Security during that period of time. If that hasn't happened, you actually can buy Medicare. It's expensive though. So Medicare covers a lot of the cost of your health care, but there are deductibles and co-insurances. Medicare has 4 parts. They're listed here. The parts cover different things, and they were actually brought into law at different times. Next slide. Part A covers hospitalization, skilled nursing home, skilled home health services, and hospice. You get Part A automatically when you turn 65. There is no premium for Part A. There is a deductible in 2022. The deductible, if you entered a hospital, is $1,556. What I want to try to do is just kind of highlight something from each of the parts that might be of interest to you. In Part A, there is now something called observation status. Maybe some of you have heard this. When you go into the hospital, you might think that you were admitted. You go into a room and you're staying there and get full care. But they have this idea of observation status is for people who don't really have the requirements for an admission. The hospital needs to tell you if you're in observation status as opposed to being admitted. And the reason you want to know that is because the payment for observation status is not under Part A, where you get 100% coverage, but under Part B. And I'm going to talk about Part B in a minute so you'll understand this. Next slide. So Part B actually covers outpatient services. For example, physician services, or diagnostic and lab tests, durable medical equipment, that type of thing. You buy Part B. Most people do that when they're 65, which is a good time to do it because if you wait later, there might be penalties. Some people do want to wait because they have coverage from a work situation, which is just fine. If you have questions about this type of thing, please feel free to call social work. We're happy to talk to you about that. The premium for Part B in 2022 is $170.10 a month for most people. The government has a tax for people who are higher income, and they will pay more for their Part B. The deductible in this year is $233 a year. So you pay the first $233, and then after, when you see a doctor, for example, and then after that, Medicare covers 80% of the cost of care. Slide D, please. I'm skipping to Part D because Part D is a prescription coverage, and I'll go back to Part C. So Part D is the most recent part that Medicare has, that government has decided. And what it is a prescription coverage. Medicare uses private insurance companies to provide the care, but they approve these companies, they monitor the companies and make sure they're doing a decent job. In Montgomery County, we have 15 plans available. The plans this year have most of them have a $480 deductible. The plans are very different. Some of them have higher premiums, some of them have less coverage, some of them cover certain drugs and not other drugs. So it's very important to look at the plans every year and make sure that these plans are right for you. And the way to do that is that you have to go to the Medicare.gov website, and they have a chart, and you put in your medications, and they help you to figure out what makes the best sense. We are more than happy in the social work department to guide you with this. We use an organization called SHIP, Senior Health Insurance Assistance Program, which helps people to get the right plans, and we're happy to answer any questions. The time to do this is during open season, which is October 15th to November 7th every year. Next slide. So I'm going back now to the Advantage Plan. Advantage plans are also managed and approved by the Medicare people. And what they have done is they have taken the monies that you would pay in for your Part B and your Part D, and they use that for these companies to develop programs, insurance programs. The companies that develop them then set their own guidelines, and you have to obey their guidelines. Basically, they're like HMOs. So you need to have you get a primary that's on their panel. The primary will send you to specialists on the panel. Their panel also has nursing homes and for skilled care and other services. So what the advantage of the Advantage program is that their premiums are cheaper. They do give you some services that you don't get under traditional Medicare, like dental, hearing, and vision. And that you can also change your Advantage program or your program at any time during open season. That is the time that you can choose to opt into or out of an Advantage program. Remember, that's October 15th to December 7th. And I do need to tell you that that's for the next year. You sign up then for January. You do want to be sure that your doctors will be covered if you go into an Advantage plan, or that you're happy to change your doctors. And the other thing I want to say about this is that I hear, I guess you do too, ads all the time on the TV and the radio about how you can get into a plan and they will cover your dental care and they will take you to appointments. And I worry about these because this time of year they should not be selling these plans, number one, and number two, you do have the concern about whether your doctors will be covered. So if you have any questions about any of this, please feel free to call us in the social work department and we will talk to you about it. Next slide. So the other thing I wanted to talk to you about is Medigap or Medicare supplemental insurance. As I told you before, there are many deductibles and co-insurance with Medicare, and what people do so they don't have all those bills is that they buy a supplemental policy. The government has standardized the supplemental policies so that if you are looking for a plan K, the plan K that Aetna sells or Blue Cross sells or Aetna or ARP sells are be the same. There will be no difference between them. So you actually can shop by price. The thing I wanted to say about this is that when you first sign up for Medicare and want to buy a supplement when you're 65, you have 6 months to buy a supplement with no medical underwriting. They cannot ask about any of your illnesses. If you wait till later, they can. And they can decide on pricing based upon the fact that you have some illnesses or taking certain medications that would indicate to them that you might be more costly for them. Next slide, please. There are some programs that help with Medicare medical costs. The ones at the beginning of the slide are for Part D. Maryland has a program, it's a state program. It's called Maryland Senior Prescription Drug Assistance Program. And that program will pay up to $50 a month of your premium for your Part D. The other thing I like about it is it gives you another time during the year that you can change your program, your Part D program. Your income for one person needs to be below $36,000 gross, or for two, $49,000 a year. The federal government has a program called Low Income Subsidy Program. This is for people with lower income, and what it does is pay the premium for the Part D and also have the cost of the medicines be much less. And that yearly income is $19,000 for a single person and $26,000 for a couple. Pharmaceutical companies also have programs that will help pay for the very expensive medicines, and they are income dependent. We help people to apply for these programs, and we're happy to help you if you give us a call. In terms of covering Medicare co-pays and what have you, there are a couple of programs. They're called the Qualified Medicare Beneficiary, it's called SLMB, Specified Low Income Medicare Beneficiary Programs, and they are income dependent, as I said. The maximum income you can have for these programs is $15,700 for a single person, $21,000 for a couple. Next slide, please. So both Ann and Sandy mentioned to you the cost of custodial care. Insurance does not cover this at all. So it becomes something you have to pay for privately. And the only way to help to get coverage for long-term care is to have a long-term care insurance. Long-term care insurance it depends on your age. It depends on lots of factors what it will cost you. So you have to sit down with a broker, with somebody, and figure out what makes the best sense. It's kind of like a formula. What do you want to pay? What do you want to get? What makes the best sense? We're happy to discuss with you your long-term care policy and whether it's something you can use now, and also to talk with you about what you're being offered, and just feel free to call us. Long-term care policies operate both at home, in assisted living, or in nursing homes. Next slide. Oh, I'm sorry, I forgot to tell you this, but the only other program, going back to the other slide, but it's okay, that helps people with long-term care costs is for low-income people. Sandy mentioned it. It's called Medical Assistance for Nursing Home Care, for people who are in nursing homes and have used up all of their resources. This is the federal government's SAFE program for people. Okay, on to advanced directives. So advanced directives are extremely important. What they allow you to do is to have your wishes obeyed even when you're unable to speak for yourself. You appoint somebody who is your healthcare agent. You let them know what you want and what you need, and they will then speak to your doctors and follow through with your needs. If you do not have an advance directive and something happens to you where you can no longer talk to your doctors, there is a way of the doctors have of figuring out what they should do. It's called substitute consent. And it's a list of people that they go through one after another and ask whether what you would want in these situations. So it starts with your guardian, and then it goes to your spouse. I just recently learned that under that category is a domestic partner. So if you're living with someone, even if it's somebody new to you, and something happens to you, that person would be above your children in making decisions for you. So if you want to make sure that the person who you trust makes decisions for you when you are not able, you must have an advance directive. Of course, it's very important that your healthcare agent be someone that will follow through on your wishes, and you certainly want to discuss with your agent what your wishes are. You do not need a lawyer to have this form filled out. We have a copy in the back. You're welcome to take them. It just requires 2 witnesses, and doesn't need a notary. We're happy to sit down with you, go over these policies, and talk to you about what you would want with them. Once you get an advance directive done, you should keep it in your home so that it's readily available, and give copies to your agent, to your doctors, and to family members. Next slide. I'm sure you've heard of the MOLST form. It's called the Maryland, now I've forgotten, doesn't matter. The MOLST form is an actual order form. It's filled out by your doctor, not by you. You talk to your doctor about what your wishes are, and they fill it out. And the reason it's done this way is that it is really developed mainly for the paramedics who would come to your house. If you have a MOLST form completed and you have it on your refrigerator where they can find it, they will obey the orders on the MOLST form. Now, if you don't have one, what the paramedics will do is do everything they can to keep you going. They'll pound on your chest, they'll do CPR, they'll put you on medications, and get you to the hospital. So if that's not something you want, then you need to have a MOLST form. But not everybody needs a MOLST form, because if you have an advance directive and you get to the hospital and it's hopeless, your healthcare agent can step in and make decisions for you. Next slide. The File of Life is the next form I wanted to talk about. It's a piece of paper that fits inside a magnetized red sleeve that goes on your refrigerator. And if you fill it out with all of your health care, insurance, and next of kin information, and if a paramedic comes to your house, they know to go to the refrigerator and pick that up. And so then they know everything about your health care, and they take it with them to the hospital. So it's really a very valuable tool, but you do need to make sure that it's updated. Next slide. The other next form that I want to talk about is a durable power of attorney. That is the financial power of attorney. I talked about the health care. This is financial. This form, if you have much of an estate, you really should go see a lawyer to have this filled out. And we do have a list of names of elder care attorneys. This allows somebody to pay your bills, make financial decisions for you if you are unable. Next slide. So today, we have tried to describe the issues social work can help you with. Please call us whenever you have a concern. We will try to help you put the pieces together in the very way that is right for you. Thank you.
Okay, so everyone's going to come up to the stage. I think we have another microphone. We can pass around to see if anybody has questions. Does anybody have any questions?
Good afternoon. First of all, I'd like to thank you all for coming and sharing all this information, because I, for one, did not know what you did. And now I am much better informed, so I really appreciate the work that went into everything. So my questions have to do with various things. And the first has to do with the HMOs or Advantage programs. My understanding is that a lot of these advertised on TV are limited. In other words, if I go to Florida for 3 months and need a doctor or whatever, they are not covered. Is that correct?
Yes, that's true for most of the programs. They will give you, you'll get emergency care.
Right.
If you go for vacation someplace and you have an HMO, you can get emergency care, but you can't get continuing ongoing care
Right.
unless they have a program in that area.
Right. So the hospitalization that may occur is not covered by Medicare? Or
The hospitalization will be covered by your HMO as an emergency.
Oh,
But
okay.
only, if you decide that you want to go Get your nose done while you're in Florida. They won't cover it.
Okay, no plastic surgery, okay. The first thing. So the other question I have had to do with all, and this is not in your domain, but you may have more information. COVID affected people in assisted living and in long-term care in disproportionate to the population that occurred. Has there been significant changes in Montgomery County, or we have to go to Montgomery County, so that this never happens again? Is there any information
I'll
that
start,
some
and
of
maybe
the laws,
Susan can add.
the laws have changed?
Well, first of all, I would say that the vaccinations have made a big difference.
Oh, yes.
In terms of the laws, people have stepped up to actually obey the laws. So there are universal precautions, there are all kinds of regulations actually that were there before with nursing homes that were not being adhered to as well as they should have. All the nursing homes now have a infectious disease person who's in charge and tries to monitor and make sure that if something happens, that the person's isolated and so on and so forth. So there's much more awareness. Maybe Susan.
Yeah, I was just going to say, I mean, I think the education that they've had, it's like baptism by fire, but the education they've gotten, I know my mom lives in an assisted living facility in this area, and the precautions that they take now, you know, just it's been a learning experience for them. So they seem to have things a lot more under control, but I think the other thing as well is said with the vaccines.
Great. The other question I have is that prescription drugs. Prior to this, under Part D, I had, say, the lowest payment for the prescription drugs. Suddenly, we have a heart condition. Suddenly, you know, the prescriptions are $400 to $600 a month. And so, I guess, you know, I'm sure we have to be aware of, you have to change and you have to pay more, otherwise your out-of-pocket will be horrendous. So can you go into that a little bit about what
Well,
happens?
that's why I try to say that you really have to look at least once a year at open season, whether your drug program is serving you well. With your conditions change and you have very expensive medications. I had one person, I'll never forget her. I went through the insurance plans with her, and by changing her plan, she would have saved $1,000 over the course of the year. So a plan that looks good, a plan that has a low premium, might not be the right plan for you if it doesn't cover your medicines well. And every year you have to look at that because it changes. They change and your conditions change.
So the prescriptions themselves, also, how much you pay for them every year changes?
Well,
In other words,
the
if
plans, the way the Part D is configured, you pay the first $480, period, okay? Then you pay 25% of the cost of the drug, and the plans pay 75%. Then you get into the coverage gap, and actually today it's the same. It's 25% that you pay, and the government pays the 75%. Then when you've paid something like $5,000 yourself, out of pocket,
Right.
you get into catastrophic. And in catastrophic, you pay very little for your medicines. So yes, it depends on the medicines you're in and it depends what the plan chooses to how they figure out their figures, whether your meds are correct for that plan or not. We do, like I said, we do look at pharmaceutical associations. Often they will help to pay for medications when they're very, very expensive.
The corporate subsidies for people for prescriptions, however, you have to have very low income in order to qualify, is that right?
I don't, what do you mean?
So if you went to Abbott Labs or somebody and you had a prescription that was quite expensive and you wanted to see if they'd help you out, it is income-based, so it's really,
It is
not
income-based,
applicable.
but some of them are pretty high income. It's interesting.
yeah,
It's well worth looking at.
yeah. The other
Right,
question.
and there, you can sometimes get samples and sometimes there's coupons, but yeah, it's a
Yeah.
very expensive endeavor, part.
Right.
Yeah.
The other question I have is legal. I know we have legal services, as you said, the Durable Power and other. Do you have referrals for just lawyers or simple wills or something like that?
Yes, we do.
You do,
Yeah,
okay.
it's on our
Okay,
list.
great. All right, well, thank you very much.
You're welcome.
Sorry to take all your time.
No,
The
that
other
was,
thing
that was
is,
wonderful. Good questions. Thank you.
are you employees of
Yes, we are
Leisure
employees
World?
of Leisure World. That's
Okay,
why
so
we do not
the
charge.
benefit that we're paying every month is for you. That is what.
Thank you.
If anybody has any questions, I can come into the audience if you can't get up, if you raise your hand. Anybody else have any questions?
Any other questions? Anyone on Zoom?
Anyone,
Oh,
I'll
okay.
send it, yes.
Well, please feel free to call us and come and see us. Oh, and look at our back table. We have a lot of good stuff out there for you.